Yes.
Yay or nay?
Yes, I can see your screen.
Jolly good. Elizabeth, can you see my screen? Oh, she's muted. What's that?
Muted.
Let's unmute everyone here. Unmute. Grigoris, Kinga, Lolita, Serge. Hello, good morning, everyone. Good morning. Good morning. Good morning. Good morning.
Good morning.
Hello.
Hello. Good morning.
Now, this, of course, is the very first time that I have ever done this using the EFAD system. And I think what might be useful is, Elizabeth, if you could turn off your webcam, I'm going to turn mine on because it will save signal strength. So if you wouldn't mind, thank you very much. Now all I need to do is to put on my webcam and then I can say good morning to you. Okay. Hello, here I am.
Hello, good morning.
Good morning, good morning. So I have put you all on chat, so you can start asking questions or whatever you think you would like to do as we go through the system. Although on your screen, on the right-hand side, there's a lot of noise going on. Okay. On the right-hand side, you'll also see that you have the opportunity to raise your hand if you want to say something. Can you see that? It's a little yellow hand on the right-hand side.
Yes.
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 Yeah?
Yes.
That
Yes.
immediately comes up on my screen, so I can see if you want to say something. If you want me to stop and answer a question, then please just raise your hand or interrupt. I don't mind whichever. That's fine. Okay. Shall we make a start this morning?
Yes, of course.
Okay, thank you. I see Aunt has joined us as well. Good morning, Aunt.
Good morning.
Oh, yes, there you go. Brilliant. Okay, so I'll make a start now. You can also move my picture about. So if you want me to be deleted, just close me down. If you want to see me, leave me on, but you can move it around the screen. So have a play as we go on. So this morning, what we want to do is introduce you to the European Dietetic Action Plan. And I hope that you have all had a copy. So I think we sent you a copy, so I hope you have at least seen it, even if you have not read it all the way through. What I'm going to try and do this morning is go through it and help us to understand a little bit more about it. Right, change slides. Mine is not deciding to change slides here. I will just bear with me a minute. Okay. I'll go back to... Okay, can you still see it? Fine. I thought I would just remind you that we now have 29 full members of EFAD, and we represent 32,000 dietitians in Europe, approximately, in 26 countries. We have over 20 higher education institutions as part of EFAD, and that means that we have an enormous what we would call reach. We can actually communicate right across Europe with dietitians. And this is politically very, very important. If we go to the Minister of Health in Europe and we say that we represent 32,000 dietitians, they sit up and they take notice. Okay, Manos, you're swiveling about in your chair.
No, not me.
Oh yes, it says Manos on my screen.
It might be some kind of noise, but it's not me.
Okay.
A child noise.
Mute
Yes,
yourself for the moment.
I will
Yeah.
mute myself.
Thank you. And Kinga, we can also hear you.
Oh, sorry, I'll mute myself then.
Thank you.
Sorry.
Come back in a minute. Don't go away. Come back in a minute.
No, I don't know what I just did. Okay, I'm listening to you. I'm sorry.
Thank you. That's okay. Thank you. Okay. So you, as presidents, know that you have to use the political agenda, whatever that may be, to the advantage of our profession. And part of that political agenda is, of course, those areas that are going to mean most to our politicians. And in the nutrition area, it's Health 2020 and the European Food and Nutrition Action Plan. And you know that it is the language that policymakers understand. It's words such as added value, multidisciplinary, economic value, cost saving. These are the kind of words that you know you use when you meet your political people in your country, or indeed the employers and others. And this is the message that we really have to get out, not only, of course, that you understand it because you do, but also that our dietitians really understand this as well. Now, this is what our ministers of health are worried about, because this costs money. And it also costs votes, because if they feel that that the country is not managing to control its overweight and obesity problems, then of course we don't like it, but they don't like it either, because it means that the health budgets are spent on areas that really could be controlled. So anything that dietitians can do to help reduce that expenditure would be music to politicians' ears. And so the politicians got together, as you know, in Vienna in 2013, and they said, we are making a commitment across Europe to reduce obesity and to reduce non-communicable diseases. So they have made a commitment across Europe. And I think as dietitians, we also need to make a commitment not only to our own countries, but also we need to do this across Europe, because then we stand with the ministers in their campaign to reduce non-communicable diseases, and particularly obesity and diabetes. And that is why the European Food and Nutrition Action Plan was published late last year. And these are some of the objectives that the ministers have agreed they will work on in their own countries. So they will work to create healthy food and drink environments. They will work to promote the gains of a healthy diet throughout the life course. They will work to make sure that health systems promote healthy diets, and of course that's us. We have a role to play in all of these objectives. They will increase their support for monitoring and research, and they will strengthen the alliances and the networks. So they are open to all people coming in to help them achieve this Food and Nutrition Action Plan. Politically, it's very important to them, because then they can come back to the voters and they can say, this is what we've done, we've saved you money, and we've created a more healthy environment. So if you haven't yet looked at the Food and Nutrition Action Plan, please do, because it is a key document which we will be working on, or the ministers will be working on, for the next 5 years. Now, as you know, IFAD attended the regional ministerial meeting in Copenhagen last year, and at that meeting 53 countries stood up and said, this is what we're doing to make a healthier Europe. And I would like to be able to stand up and say, this is what dietitians are doing to create a healthier Europe. Imagine the impact that that would have on ministers of health in Europe if dietitians stood up and said, this is what we are doing. And it's interesting that at the meeting back in September, there was a nursing group, the European nurses, who had a separate parallel meeting which ministers of health could come to, and nurses were saying, this is what we are doing to improve health in Europe. And I would like to hold one for dietitians, for telling ministers what dietitians are doing, as a parallel session at one of those regional meetings. I think that would be excellent. But what are we going to tell them? What are we going to tell them we are doing to meet the Health 2020 agenda or the Food and Nutrition Action Plan? Because that's what they want to hear. Now, this is my understanding of what national associations do, and you can tell me if I'm wrong, but they work for their members, of course. They advance the profession in their own country, and of course you, through your presidencies, show great leadership of your profession, of the dietetic profession in your country. You're influenced by many things, including national plans and policies for employment, for health, for education, and there are legal systems which influence you, but primarily, of course, you respond to your members' needs. What happens in your own country, of course, is influenced by what Europe says. If we're members of the EU, then we are bound to respect some of the policies, some of the legal frameworks, some of the leadership which Europe provides. And therefore, we need also to think we respond nationally, but we also respond in a European context. So what is IFAD's role here? Well, we think that IFAD provides briefing on EU matters to the associations. We also provide resources, so we monitor, we encourage best practice such as sharing at general meetings, and of course we work for and on behalf of yourselves. So we have a supporting role very much. We take what we understand is happening at Europe and we give it to you in a way, hopefully, that makes sense. So we issue some policy briefings. Today is a policy briefing in a way, and of course our committees produce materials that you want, such as the European dietetic competency statements for those coming into the profession. And we provide those so that you can use them to take into your own country, amend and use in a way that is appropriate to you. But we also produce it because it helps if, for example, with competencies, people moving across borders, which is a very important and real concern within Europe. So that is the role that we are seeing at the moment that IFAD provides. You tell us what more you want. You say, we would like a dietetic action plan. That's what we would like. And so we listened and we responded to that mandate. And that's why today we are going to share what we've been doing on your behalf. We take then what you have given us, any evidence that you've given us, and we feed that back into Europe at whatever level we can do. And I think the ministerial meeting is just one of those levels that we can provide feedback into Europe about what dietitians are doing. And you can see that it becomes a circle then, so we can influence what's happening. Hopefully that comes down into national plans and goes round in that circle. So, 32,000 dietitians in 26 countries, all working to the European Food and Nutrition Action Plan and Health 2020. And this is where UDAP, European Dietetic Action Plan, comes into its own, because it has been written with dietitians in mind, particularly, and that's what I want to talk to you this morning about, exactly whether it is beginning, may not be there yet, but is it beginning to meet your requirements. So these are the objectives that we are proposing for the consultation which is going to happen now. This first objective is very, very similar to the Food and Nutrition Action Plan. We've included affordable and attractive in it, because we think dietitians have a particular role in thinking about the affordability and the preparation and the appearance of food. The second one, again, is very similar to the Food and Nutrition Action Plan, except we have added in community and clinical settings, because we don't just operate on a community level, we also operate in a clinical area. And we think, your executive committee are proposing to you that we also ought to be very concerned about vulnerable groups in the clinical setting. We also have added in here to other health professions and, of course, to our authorities. And again, we've emphasized that we work not only in the community, but also in clinical settings. So we think that's very much part of a dietetic action plan. Objective 4 is quite different, because Objective 4 talks about the cost, but moreover the effectiveness of dietitians in the delivery of better health through improved nutrition. This is really right at the core of our being. And this again is going to be a very important political statement. If we can show that we are establishing not only the effectiveness but the cost effectiveness, then our employers and particularly our ministers are going to be very grateful for that. Also, of course, our own clients, our client group, are going to be very pleased that we're effective and cost effective. And the final one is, as the Food and Nutrition Action Plan, which is to strengthen the governance, alliance and networks, because dietitians don't just operate on their own, they operate across the board This is the draft currently out for consultation. You may say, well, where's research? Where's the evidence base? Where is that amongst this particular set of objectives? And that might be something you want to feed back and say that needs to be put in here. But in a moment, I hope I'm going to show you where research and evidence comes in the way we're proposing you consider this action plan. I was on the British Dietetic Association website recently, and I came across this particular statement, and I want to particularly highlight this to you because it talks here about influencing, which I think is really what we're trying to do. And we think the British Dietetic Association is trying to say to us, think nationally, but act locally. And I think that's really quite useful for us, because if we think about influencing in Europe, we're operating all of us nationally. We have to. That's where our base is. But we need to act locally. We need our dietitians to be doing and responding as they are at the moment, but maybe we don't always know how they're responding locally. And if we knew the local responses at national level, we could then talk about those not only nationally, but also within Europe. Here's an example. This was written up in our last newsletter. Objective 2 talks about promoting the gains of a healthy diet throughout the life course, especially for the most vulnerable groups. And in Austria, a group of Austrian dietitians created what they've called a disease prevention, and my picture is just over that, so I can't actually read what it says. Vacation, a disease prevention vacation. And if you read the article, you'll realize that what they did was they teamed up with an insurance company and they plotted out a route, a hiking and physical activity route. They talked to restaurants on the way of this route, and they have a healthy menu provided, and there are talks and dietitians and counseling going on. Now, that is really, I think, quite something. And what it says to me is, come on, sorry, go back, okay, is they've thought locally. This is a local thing. It's not the whole of Austria. It's only local. They've thought locally and they've acted. What we now need to know is how many people registered, what do the menus change, what do they look like, what do the people coming on the vacation think, and then of course in the long term we need to know, did it make a difference? That's not difficult to collect. You can do it with questionnaires, you can do it with interviews. It's not difficult. This is thinking locally, getting some evidence, and then promoting it nationally. Thinking about it. Maybe this is something others can do. So that's what I mean when I say local, act local, but think national, think European. So going back to our Food and Nutrition Action Plan, or our UDAP, there are 5 main objectives that we have put down. These are in draft. Please comment. Underneath those, just like in the Food and Nutrition Action Plan, there are actions. These are examples and suggested ways that an objective can be met. They are suggestions. And they need to be influenced by your own national plans. So let me show you. Objective 2, as we've seen, is promote gains of healthy diet. The examples that dietitians here could do in order to achieve this, but not only this, you could do other things. For example, here's one. Develop processes for systematic development of guidelines, care pathways, and other initiatives, which will lead to better nutritional care and interventions and enhance the quality of life. That may be something that you're already doing. Brilliant. Act locally. In the UK, I know that in many different dietetic departments in a clinical environment, they have produced care pathways. And that has led to better nutritional care and interventions. That's what they're doing now. The question is it working? How is it working? And do we know about this at national level? Promote healthy eating and physical activity schemes. That reminds me of the Austrian example. So you can see, I hope, that these actions are suggested that you see on the page, but they can be national actions, nationally. What do we want to do in our country in order to show anyone who's interested that we are promoting the gains of a healthy diet? So having decided on the actions, and you may only have one, you might decide in your country one is sufficient. But there are going to be many dietitians acting locally with that one example. I don't know. Up to you. And then, of course, for the actual local, it has to have a target. So this is completed at local level. A target, a specific area targeted by the NDA. Could be a vacation, as they showed in Austria. Here's an example that's in the implementation plan that was sent to you. Select an objective, for example, healthy food and nutrition is accessible. Discuss it in your NDA. Take one of those actions, a scheme to promote a healthy diet in school, for example. Could be an action. And then say, what are we going to do about this? How are we going to show that we are promoting a healthy diet in school? And the NDA could write and publish a document about school nutrition teams, for example. That's a very specific local example. And they could write about it, consult on it, was it a good thing to do? Write about the outcomes and send this to the Ministers for Education, Health and others. And what would that do? It would show that you were thinking about ensuring healthy food and nutrition is acceptable. I think you're already doing this, and it would be great to know what you are doing. Here's an example. This is an example from Holland, from Amsterdam, in which, again, working with insurance companies and the community, the Dutch dietitians here have worked to look at obesity prevalence, and that would meet objective 1 of UDAP. Would also meet, of course, the first objective of the Food and Nutrition Action Plan. Wouldn't it be great if I could stand up and say to 53 ministers of health, this is what dietitians are doing, and this is what they're doing in the Netherlands. And then with the Dutch Minister of Health at that meeting, they would stand up and say, yeah, this is what happened, and this is what's the outcome of this. Just imagine how amazing that would be. So this is a target, the actual implementation, the actual work going on. This is a target. Local. National, local. Here's another one. This one is to look at advertising of unhealthy products. Dietitians in a specialist group could hold a national conference or a local conference where they invited key stakeholders to discuss children and advertising, and then they could publish the evaluation of that conference and maybe propose actions to key stakeholders. Brilliant. Locally done, nationally reported. Along the way, we've added in some helpful definitions because sometimes it's difficult to communicate, and I'm sure you'll have a lot to say about whether these definitions are in fact helpful. It's important to gather evidence of what we've been doing, and we're going to use the term key performance indicator as a way of monitoring and providing evidence. And a key performance indicator is what we say we're going to measure, what we say we're going to collect evidence, for example, that 100 people came to the conference. That is a performance indicator. What is an objective? What is an action? What is a target? Again, if these are not clear, please would you let us know. Consultation covers all of these things. So what are we proposing you might like to do? Again, tell us if you think this is completely wrong, but this is what we're proposing. We're proposing that you identify priority objectives and actions, but bearing in mind your own national strategic plan for food and nutrition, because that's what we're trying to show the dietitians are contributing to. We suggest that you select a UDAP champion. In other words, somebody who can liaise directly with IFAD about this whole action plan. We think delegates have more than enough to do, and we would like to suggest that you have somebody, not the delegate, but somebody who's really interested in trying to promote this action plan and to work providing information to IFAD, summaries, looking at KPIs, and so on. We would like you, when you have these outcomes, to communicate them, not only to us, but to anyone you think is important. We'd like you to state a target for each action and monitor the outcome through a key performance indicator. And we'd like you, of course, to gather, or the champion to gather, the evidence, evaluate and review. We're not expecting this to happen all in a year. We're expecting this to take many months and possibly 2 or 3 years, because you know change doesn't happen quickly. If you've already been doing this for a number of years and you can see change, please let us know. We would love to know what's going on. I say IFAD would love to know, because we want to promote dietitians in Europe. We want to be able to stand up and say, this is what dietitians are doing, and this is how we know that they're actually being effective or even cost effective. So we have a role. We have a supportive role, an empowering role, and a promotional role. We want to provide webinars and briefing papers, and this is the first one, and there will be others. We want to provide information to help you to actually, well, in any way that you think is going to be helpful to you, please let us know. We'd like to play a coordinating role, linking UDAP champions with each other, and of course, as usual, we will have a reporting and a lobbying role at European level and any other level that you think is appropriate for us to take. I wanted to remind you of the complexity now of IFAD. and the committees and the support that they can give to you. And of course, thank you for volunteering your dietitians to be part of these committees, because I hope they're feeding back to you the work that they're doing. So we have lifelong learning and education, we have professional practice, we have research and evidence-based, and of course we have our specialist networks. And all of these are working across Europe, they're working nationally, and if there's more that you can see that can improve how we do things, then of course the general meeting is the place, or indeed any correspondence, let us know. And of course, now that we have our HEIs, we want to draw them more into the framework, and we want them to be supportive to the committees, which of course they are already working with the committees, but we really need them also to be on board with UDAP if you accept it. So this is I think my last slide, because I want just to remind us that this is the mission, vision and aims of EFAD. I've got UDAP on my mind here. I hope you can see that by producing this draft we are supporting you and encouraging you and just working with you to develop the role that dietitians have in improving nutritional health in Europe. Our vision is that, of course, you particularly and your dietitians are going to be leaders in the field of dietetics and nutrition. And by growing our partnerships and improving health, we will be able to demonstrate our contribution to European economic prosperity, which of course is a really, really important message. And in order to do that, we are working hard within EFAD to support the quality of dietetic education, professional practice, research activity, and partnership. And this, of course, is largely through our committee structure. And of course, we want to be fair, we want to be open, we want to be collaborative. And that is the end, really, of what I want to say this morning in a formal way. I'm going to open now for questions and thoughts and comments that you might have. Please complete the consultation exercise. I hope Judith has managed to record this, because if she has, you can go back and look at it if you want. But the other thing is that we're going to repeat this for anyone who wants to listen to it now. We wanted it to come to you very first, so you understand or have some insights, and then we're going to send it out to the specialist networks, we're going to send it out to the committees, and we're going to open it up for more general consultation. That was our plan. If you think that's not a good idea, let us know. And we'll do another webinar, briefing webinar. I was thinking this morning as I was preparing for this that it would be good to do a webinar particularly for our HEIs, but maybe you would like to do that. Maybe you want to talk to them more directly. So there's all sorts of things. Once we get the UDAP, the Dietitians Action Plan, in a place that we would like it to be, then we can do even more with it. So what we're hoping is that in October you will agree, there will be a resolution to adopt a final UDAP, and that we can work in some workshops to begin to think about objectives and actions and key performance indicators. And we would like you to come back to us at the general meeting and tell us what you're already doing, how you're already meeting some of these objectives, how you're using the KPIs to inform an evidence-based approach. I'm going to stop there because it would be good to hear and invite you in now to actually get involved with this discussion. And that's the beauty of this webinar. So if you've been muting yourself, please feel free to unmute yourself and to either raise your hand, or if there is a pause in the conversation, please jump in. So I hope that's been helpful. If you would like me to do any more, please let me know. Otherwise, let's just sort of now share our immediate thoughts about this action plan, this draft action plan. Thank you. I'm going to have a sip of tea. No, I don't see any hands coming up at all. So
I can't see any hands, but I hope my voice is on.
It's
Could you hear me?
perfect. Perfect, Elizabeth. Thank you. Yeah.
Thanks for a very nice presentation, and it's very valuable that we could get these slides for our national discussions.
Yeah.
From a Swedish perspective, I think we already do very much.
Good.
The problem is to translate all these into English, because I suppose there are no money to help us with translation, so we need to do it ourselves, or?
I think you're right. You're right, Elizabeth. We don't. But I know countries doing this, and maybe only one or two need to be translated. And we are suggesting that you do not need to do the whole thing. You could just write perhaps a couple of hundred words about it is more than enough to actually share with each other and with ministers. So I think we're suggesting just short summaries would be very helpful.
And until when do you need that short summary?
We would like to see them, Elizabeth, at the October meeting.
Okay. Because in Sweden there is a national action plan going on. First focusing on one thing, and then the focus has shifted a little bit, but it's very much about non-communicable diseases, and it's very much aimed to be a networking project, all healthcare professionals together. So I'm happy to share what the dietitians in Sweden are doing as our part of that work.
That would be great. Thank you so much. Wonderful. Lovely. What do you think about this European action plan? Do you think it is it's meaningful? Do you think it's something that dietitians across Europe can work on?
Oh yes. I think we should do our parallel action plan to the European action plan, but just from a dietetic point of view. And you stress that, and I think it's very important. It's not just a question about the metabolic syndrome, overweight, obesity. We also have the other part of the problem with the malnutrition.
Yeah.
And there is a growing proportion of elderly people in almost all European countries. So I think it's our task to really show that nutritional problems are not only equal to overweight, obesity, too much food, but non-communicable diseases often lead in the long run also to malnutrition. So there is a link to non-communicable diseases. And with the knowledge we have, we could stress these relationships.
Yeah, very good. I agree. Yeah. Good, thank you. Anyone else? Arndt, does this sound reasonable to you? Is it the kind of thing that might be something which you could see operating in Norway?
I think that the UDAP is an excellent idea, and I think this is the right direction for IFA to go, because if we don't speak to the politicians, we don't discuss with the politicians and show them what we can actually do, well, then IRFAD is just a discussion panel, which is not really the point. So I think this is a very good direction for IRFAD. I agree totally.
And do you have some good examples, do you think you could bring to our meeting in October? I'm sure you will.
We have some examples that we have been lobbying towards the politicians, and we are getting some results, so I will definitely bring those to Amsterdam, yes.
Thank you. Marvelous. Marvelous. Grigoris, what about the idea of the key performance indicators? Do you see that this would be providing us with important evidence? Do you think your dietitians will be using these or could use them?
Well, in any case, we need KPIs, because if we don't have KPIs, we cannot, really support that what we are doing has any effectiveness or is efficient or cost effective. I know that till today, and I'm sure that this is the case in a lot of countries, we were doing as associations or as individuals or in professional groups. We're doing a lot of work in the, both in the public health area and in the clinical area, but the main problem with dietitians and maybe with other professionals also is that we don't record what we do. So KPIs is a way to quantify what we do and show that it is leading somewhere and has and we are doing work that has certain impact on certain targets. So yes, it is something that is very important, very useful, and we must learn how to work with KPIs, both as associations and as individuals, as professionals also.
Now, just stay with the KPIs for a minute. I wondered whether we should ask our Research and Evidence-Based Practice Committee to do some more teaching about how you get a KPI and how you use it. And then also, I wondered whether it would be important to talk to the HEI members about making sure that they teach it to new dietitians that they are preparing, because I think IFAD could play a supportive role here in helping to make sure that all dietitians, when they leave their courses, know about KPIs and know how to use them. So I think there's something that both our Research and Evidence-Based Practice Committee can do and also our universities.
Yes, that would be that would be very useful to of course to the future colleagues and to a lot of the current colleagues. So yes, that would be a very good idea. And actually, as you can understand, you said that from the objectives that you've just presented to us, there isn't any mention to research, but the whole exercise is a research exercise.
Yes, 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 exactly. And that's one of the reasons we didn't put it in, because as I said, as you go through it, you begin to realize that we are collecting evidence all the way. Serge, what are your views on this? Are you muted? Unmute yourself if you are. Ah, that's good.
So there was a lot of noise, so I mute my phone. So for your information, we are now working on this project with the regional government, and so, but mainly based on infant, adolescents, people. And so at this time it will be very interesting for us to adapt and to know that every countries in Europe will have the same target, and it will have more impact on the negotiation with the government.
Yeah, yeah. And I think, you know, in, let's say, October 2020,
yes,
the general meeting for IFAD, we could share every year. We could share more about what we're doing to meet the Dietetic Action Plan in each country. Wouldn't that be an amazing thing to do?
yes.
I think it would be great. But it's good to hear that you see this as an important European paper, and to know that others are working, because that way we can support each other. So the Austrian plan, you could now think, oh, could we do that in Greece? Could we do that in Belgium? Could we do that in Norway? And you can begin to see that there are good ideas from different countries which could contribute to meeting better health in Europe. So it's good to share that information.
So, okay.
Yeah, thank you. Kinga, what are your immediate thoughts? You need to unmute yourself, I think.
Yes, can you hear me?
I can, yes.
Can you hear me now?
We can, yes. Yes, we can.
Well, you probably know that the situation is pretty different in our country, and
yes.
At the very, very beginning of everything with dietetics. And now we are working on recognizing on a collaboration between us and the Minister of Health. Because the way we stand now, I think that any paper we would send to them probably would be ignored. That's the way things stand now. So we have to start with establishing some kind of relationship with the health minister. Besides that, I think it's a very, very complex and very well established plan, what you just presented to us, and I see that in many, many years, I think, and I hope that it could be realized, it could be done also in our country. Now, at the beginning, I think that till October, maybe, I cannot promise, but I think that we could prepare some things to summarize. We have some smaller projects, local projects, very, very low, very small projects, but I think it's good for the beginning, and it's a good example for future dietitians. So that's how I think things should go to start to establish some kind of relationship with the health minister. No, we are preparing to go again in the parliament. We are invited to go to a committee there, and I think that we will try to go from here.
Yeah,
so.
and I, as I said, I think if you speak their language, so if you say that dietitians are contributing to the objectives of the Food and Nutrition Action Plan through our own action plan, that is really important that they hear that, because then they will understand that you can help them. You can help them get what they need, because politicians need help. and the more you can help them, the more they will be pleased. So don't go asking, but say, we can help. There you are. So very good.
Yeah, sure, this also. Thank you very much.
Yes, you're very welcome. Okay. So is there is there anyone else that would like to make a comment or tell us about what's going on in their own country? No? Okay. Okay. Well, as I said, we're going to now repeat this webinar. We will repeat it for our other key members of EFAD, and then we'll open it up for more consultation, because the more people that look at it, the more ideas we get, the better will become our understanding of what actually dietitians think is important to be happening within Europe. I'll also pass on the ideas to our HEI colleagues and to the Research and Evidence-Based Practice Committee about more information about KPIs and how we go about collecting the evidence. I think that's important. And also that we can come back to this when you've had a chance to look at it a bit more. We can come back to this at our meeting on the 22nd of April when we want to talk about the UDAP, but we also want to talk about what information we are collecting about the charity. We're going to look a little bit about the budget and also about the special relationship that we are proposing we enter into with the WHO. So there are lots of things that we would like your views on the 22nd of April, and I look forward to meeting with you then. But I think I'll call a halt to the meeting. Please, if you want to say anything, write, consult, give us the information, and we will do what you think is the best way to promote dietetics and dietitians in Europe, supporting you all the time nationally. So I'm going to say goodbye. We've, I think, had a successful webinar. It will be on the website. The slides will be on the website. So please make good use of them in any way that you think is going to promote dietetics. So I'm going to say goodbye. Thank you. And I hope you've found it useful.
Thank you.
Thank you.
Thanks a lot. Thank you.
Have a good day. Have a good day.
Have a good time. Bye-bye.
Bye-bye.